Hej till er som tar del av den här sändningen.
Welcome to everyone watching this broadcast. We have Minister for Social Welfare Camilla Grönwall, Social Security Minister Tenje, Fredrik Malm from the Liberal Party, and the Ukrainian Ambassador to Sweden Svitlana Zalishchuk. After the press conference is over, the presentation will be available at regeringen.se.
Varmt välkomna till
So, a warm welcome to this press conference.
Ambassador of Ukraine to Sweden.
The Ukrainian healthcare and their social security is currently under attack. The Ukrainian people is showing incredible resilience and incredible courage and incredible strength. The Ukrainian healthcare system is every day under terrible condition, enormous fantastic work and incredible sacrifices. Russia continued their attacks against civilian infrastructure, housing residences. We know what they do to the electrical grid and what they do against hospitals, and it's always the civilian population that pay the highest price. In 2026 alone, WHO has registered 36 attacks against the healthcare infrastructure in Ukraine. Last week, we heard reports about a maternity hospital in Zaporizhzhia, places that represent life, safety, and hope become targets in this Russian war of aggression. This highlights the importance of the Swedish position. Sweden will be a reliable, long-term, resilient partner of Ukraine. It is, of course, about solidarity, but it's also about responsibility for European security. And it is about ensuring that the Swedish support actually corresponds to the real needs in Ukraine. And in this context, we've had long discussions with Ukraine. I've met my own counterpart in Ukraine, Viktor Jakob, on several occasions to discuss what this support might look like. And that is also the background to this government in 2023 entering into a partnership agreement with Ukraine, both within healthcare and in social policy. And that the government in 2024 tasked the Board of Health and Social Welfare to coordinate the construction of infrastructure within these fields. This assignment is linked directly to the partnership agreement identified in the agreement and to the government's strategy for reform and reconstruction in Ukraine. The aim of this assignment is also to strengthen Ukraine on their path to a future membership of the European Union. The Ukrainian Ministries of Health and Social Affairs have requested a transfer of knowledge within fields that we have expertise from many public stakeholders, but this is not a one-way street. Sweden and the Swedish authorities has also a lot to learn from Ukraine, not least when it comes to preparedness within healthcare and social services and how critical operations can continue to operate during war. This means that the Board of Health and Social Welfare will draft a program within social policy and healthcare policy, a program that will make it possible for authorities and other public stakeholders to contribute to this transfer of knowledge and building of capacity in Ukraine, and also harness the Ukrainian experience. This program has been drafted in close collaboration with the Board of Public Health and Social Welfare and several stakeholders in Ukraine. And we know there has been close dialogue with the Ukrainian ministries in order to ensure that this support is requested, relevant, and governed by needs. Last spring, we decided to fund this program 69 million krona from 2025 to 27. And SIDA has now taken a joint decision to strengthen this financing with another 60 million krona, which is close to a doubling of this program, which overall will amount to 129.5 million krona. This will be implemented by the Board of Health and Social Welfare, but also by several other public stakeholders, such as the Public Health Agency, the Medical Agency, and several university hospitals. This shows the wide-ranging effort within this partnership, and it sends a clear signal. Sweden will stand with the Ukrainian people as long as it will take. And Sweden will continue to contribute to Ukraine's reform effort and their path to the European Union, particularly within fields that concern people in vulnerable positions. And with that, I'll cede the floor to our Minister of Social Services. Thank you, Jakob. It is always the children that are hardest hit in times of crisis and conflict. And after close to 4 years since the Russian full-scale invasion, the price paid by the Ukrainian children has been incredibly high. It is about children who have lost their safety, their normality, and in many cases their families. Another group that has suffered disproportionately is people with disabilities. The war has aggravated the vulnerability for a group that even before the war belonged to one of the most marginalized group in the country. And over the past few years, there has been comprehensive reform efforts in Ukraine, and in spite of the full-scale invasion, they have chosen to invest in children and people with disabilities. Through comprehensive reforms, the social services have been strengthened. They've expanded the support to families with children, and they have prioritized foster care before institutionalizing for those children who need to be cared for. This is work that in Ukraine is often designated better care reform. And I'm deeply impressed by the Ukrainian government, which in the midst of a full-scale invasion are implementing necessary and comprehensive reforms that are about ensuring that all children's rights are prioritized. When a country is at war, it may feel evident that other people must take priority. In light of that, you might ask yourself the question whether it's really right to prioritize an exchange of experience and building capacity within social services in the midst of an ongoing war. And my answer to that is yes. Strengthening skill levels and capacities in social services are crucial because it is about the safety of the children in the here and now, but it's also about their future. I myself have seen on site the effect that our bilateral partnership can have. In Ukraine, over the past few years, partly financed by Sweden, established so-called resilience centers. They provide psychosocial support and other forms of support for veterans and their families. And this has been partly inspired by the Swedish model of family centers. On site, I have gone from the darkest of darkness of what humanity can do in Bucha, from the memorial site in the church and all the pictures, and walked 300 meters to a resilience center representing hope and the future, where people were treated for trauma and where children are playing and people who have been touched by the war have received support and help to go towards a brighter future. So I'm very proud of the fact that Sweden is a close partner of Ukraine in this work that is currently ongoing, both in order to strengthen inclusion of people with disabilities in society and to strengthen the rights of children and thereby creating a brighter future. In order to do this, Sweden has set aside 31 million krona in this support program for the period 2025 to 27. This funding should contribute to developing social services and ensuring that more children and adolescents will grow up in a safe family environment, even in a time characterized by war. Ukraine is Sweden's most important foreign policy priority. When we say that we stand by the Ukrainian people, we mean that we also believe in children's future and in a society where the next generation can grow up in safety. Thank you. I will now cede the floor to the Minister for Older People and Social Security, Tenje. Thank you, Camilla. Yes, the partnership between Sweden and Ukraine is definitely a valuable resource when it comes to the very comprehensive reforms that are being implemented in Ukraine. And it's very positive that we see such a wide range of Swedish public agencies that are involved in this support to Ukraine. The support that we're presenting here today showed the range within both healthcare and the social policy field, and all of this is aimed at helping Ukraine in the present in times of crisis and war, but it will also contribute to Ukraine's future path towards the European Union. The efforts from our Swedish authorities will lead to the social services in Ukraine becoming stronger, and at the same time we have an opportunity to draw conclusions and analyze the very important work going on in Ukraine during the war and during this crisis, and that will eventually strengthen Sweden as well. And this is very important. It's a long-term effort, and the humanitarian support and the support to civilians that Sweden is providing Ukraine is definitely set in stone. It's been close to 4 years since Russia's full-scale invasion began, and Ukraine continued to fight for their independence and for their freedom. Ukraine, as you know, is not only fighting for their freedom, their independence, but also for the freedom and independence of Europe and Sweden. So the support programs that we provide now is an obligation that we have to stand by, as Jakob Forssmed says, to stand by Ukraine for as long as it takes. And this is also an investment in our own security in order to build our resilience as well. The situation in Ukraine is a humanitarian crisis, and just as Minister Grönwall says, it is particularly vulnerable groups that suffer the most: children, people with disabilities, but also the elderly. Russia's full-scale invasion has further aggravated the demographic situation in Ukraine with an aging population where the men are at the front lines, where women and children take refuge, but where older people often remain in their homes. In 2024, Ukraine adopted a national strategy for the demographic developments in the country, and they highlight the need for creating conditions for active aging, a longer working life, and improved health among the aging population, as well as to create greater independence and integrity for the elderly. In addition to this, there is also a great need for a well-developed and reformed elderly care. And in 2025, myself, together with Minister Waltersson Grönwall, had an opportunity to visit Lviv during a conference that Ukraine and Sweden and a number of other countries arranged together. And it focused on children and the elderly. Before the visit, the government tasked the Board of Health and Social Welfare to look into the conditions for supporting Ukraine within elderly care. Within other areas, we already had partnerships in place, but here we saw the necessity of strengthening these efforts further. And the aim of this was to strengthen the structure, the system around elderly care in Ukraine. And this is very important, just as I said before, in the crisis right now during the war, but also in order to be able to build a stronger social welfare system in Ukraine in order to facilitate their membership in the European Union. Last autumn, the Ukrainian Minister for Social Affairs, Denis Ilyutin, visited Sweden, and we discussed in length the challenges with an aging population that Ukraine has at the present, but we see the same trend in our own country as well. And one matter that I'm passionate about is dementia care, and myself and my counterparty in Ukraine had the opportunity to visit Sylvia Hemmet together with Her Royal Highness Queen Sylvia in order to discuss how dementia care in Ukraine can develop further and improve. And Sylvia Hemmet is a center with daily activities for people with dementia. Older people who need medical care is a particularly vulnerable group, just as I said, both in war and in times of peace. And I'm very proud that Sweden can be part of inspiring Ukraine with our knowledge and our experience of elderly care to be able to contribute to build and strengthen the reforms that are being implemented right now in the midst of war in Ukraine within elderly care. But this support is not only a one-way street. We have a lot as well to learn from how Ukraine prepare their own social welfare systems, not least elderly care in times of crisis and war. And just as I mentioned, we have seen that older people tend to stay at the front line. They do not want to move. They don't want to evacuate. So you need to design models for support and for healthcare to be able to provide that on site for people who cannot or do not want to leave. And here, unfortunately, Ukraine has extensive experience that we can learn from in Sweden. And based on the remit from the government to the Board of Health and Social Welfare in May, through an agreement between SIDA and the board, has enabled us to set aside 14 million krona for a partnership between Swedish public stakeholders and their counterparties in Ukraine from 2026 to 2027. And these agencies will, for example, contribute to a person-focused care system in Ukraine, where developed home care services provide support and care to people, particularly with dementia. And with that, I'll cede the floor to Fredrik Malm from the Liberal Party, please. Thank you so much, Anna. Yes, we and Sweden will stand by Ukraine, and in particular, Ukraine is standing in front of us. They are suffering terrible consequences by the population every day across the entire country, a very large country. On the 24th of February this year, this war will enter its 5th year, and we must not forget, we have to understand that the Russian regime and their goal is to eradicate Ukraine as an independent state. They want to turn Ukraine into a historical parenthesis. And that's where their attack across the entirety of Ukraine, not only at the front lines, and there is enormous pressure on the healthcare system, particularly the elderly and those with disabilities. And in addition, Ukraine value the life of their soldiers highly, far more highly than the Russian invading army. They also value their civilians very highly. And this means that these partnerships and the support that we are able to provide to Ukrainian healthcare services is incredibly important in order for Ukraine to be able to suffer through this. In more tangible terms, 23.5 million krona during this period from 25 to 27 will be provided to various hospital partnerships. It's called International Medical Partnerships, and that is through an agreement between our aid agency SIDA and the Board of Health and Social Welfare, and a number of Swedish hospitals such as Karolinska University Hospital, including also Astrid Lindgren's Pediatric Hospital, Sahlgrenska University Hospital, the University Hospital in Skåne. All of those have ongoing partnerships with various hospitals in Ukraine. And there is also a number of partnerships within more specific medical fields, such as oncology and specialized pediatric care. And Swedish hospital has also a lot to learn from Ukraine for our own crisis preparedness and our own preparedness for our healthcare system in times of war, including areas such as trauma surgery. So these partnerships are incredibly important to Ukraine. They're also very important to Sweden. And it's important that we continuously keep progressing our support for the Ukrainian healthcare, considering the fact that this war is nowhere near an end. And as we heard from our ministers about their visit to Lviv, visits to various clinics and hospitals there and in other places in Ukraine, I myself have visited these clinics, seen how they are designing prosthetics and many other things. And with that, I'll see the floor back to you, Jakob. Thank you. I will say a few words about a specific threat that is growing in Ukraine right now, where we see a skyrocketing increase in resistant bacteria and care-related infections, both among military personnel and civilians. And why do I want to mention this? Well, this is a threat to modern healthcare in Ukraine if they cannot stop resistant bacteria, but it's also a regional threat to Europe, and it can become a global threat as well. This is somewhat of a perfect storm when you have a war when it comes to antibiotic resistance. War injuries play a huge part in this, but also that is very difficult in a society where you have deficiencies in the structure around healthcare, where people at the same time are looking for normal healthcare. This risk driving development of resistant bacteria is difficult to maintain infection control that increases the rate of contagion, which leads to more ill health and a higher mortality rate. And here Sweden can make a difference based on the experience and the knowledge we have, and I'm very happy to see the Public Health Agency heading a project in close collaboration with international and Swedish stakeholders to support the introduction of Ukraine's National Action Plan against antibiotic resistance, improving laboratory monitoring through the acquisition of necessary material required to discover and limit the resistance, and also for strengthening the preventive work within healthcare through training and improved procedures for infection control. And we have reserved 30 million krona for this vital work. It's incredibly important in order to maintain capacity in the Ukrainian healthcare system, but also in order to protect the healthcare systems around Europe. Another important area for Ukraine and for their entry into the European Union is within pharmaceuticals. And the medical agency have had partnerships with Ukrainian counterparties in order to strengthen and develop regulatory frameworks for pharmaceutical approvals and medical devices supervision. In this case, it's good that they continue to be funded to continue and develop this very important partnership with Ukraine together with Ukrainian stakeholders and stakeholders in other European member states in order to build a robust medical products agency in Ukraine. And we are reserving 16.4 million krona in order to promote this and adapt it to the European regulations. This is very important. Also parallel to what's happening right now and continuing to our work to support Ukraine in their adapting to the European Union. And with that, I'd like to cede the floor to Ambassador Svitlana Zalishchuk.
Dear journalists, I would like to say that Sweden today is not just our partner, but essential part of Ukraine's resilience. And while Russia sends us rockets every day, Sweden sends us support. And this is not just abstract solidarity. These are decisions, these are actions, and these are resources that make difference in Ukraine. So first of all, I would like to thank you on behalf of Ukrainian people, on behalf of Ukrainian government, to you, dear colleagues, that you're working on these packages of support to Ukraine, but also to the whole Swedish government, to Swedish taxpayers, to Swedish people, everyone who stand with us and who contribute to the victory of our country. Also, I would like to thank you on behalf, as a mother actually, on behalf of every parent in Ukraine and every child which life has been saved. I arrived here in September and I had a chance to visit Karolinska Hospital, which is cooperating with the biggest Ukrainian children's hospital, Ohmadit. And this is one of the projects that your government is supporting. And within this project, I've seen that Ukrainian doctors are going through certain training here in Sweden, working with machines called ACM, a very sophisticated equipment that helps to save children's life. And I've heard the stories from Ukrainian doctors who came here, and what they told me is that you stand in front of a child, you feel that the life is basically disappearing, but then you use this equipment, a revival which helps to revive the life functions of a body, and you feel that it actually comes back in your hands. So I want to underline that this help that we are talking today, it can be this difference between life and death in hands of Ukrainian doctors today in Ukraine. What can be more important or more tangible than this support? You know, when we talk about Ukrainian war, often we think about frontline, but Russian frontline lays through Ukrainian hospitals and just houses, our homes, and institutions for elderly people that you, Anna, were talking about. And it kills everyone, but it affects most vulnerable. And today's package that Swedish government just introduced is going actually into that direction to help those people that needs it most. Today we are almost starting the 5th year of this brutal war, and hundreds of people, hundreds of children have been killed, thousands of children have been wounded. More than 20,000 of children have been kidnapped. Many have lost their families, parents. Today, elderly people, you know that it's very difficult situation in the energy. So +5 in some of our homes, +5 in kindergartens that children go to. Very often elderly people that are living on the top floors in some multi-stored buildings cannot go down. With their pain in knees, for example, the elevators just simply don't work for days. This is the situation we are facing. So this help is extremely important. But one more thing I would like to stress is that you're not just helping the country that is fighting this war. So you're not just helping us in the most difficult times, but you are helping the country which is going through reforms to get to the European Union, to be a member of the European Union. You are helping the country that is actually prevailing and stands there and is not going to give up. I was in touch with my friend just recently, and I said, "How are you?" She said, "Water, rarely, electricity, sometimes, no heating for weeks, and it's very frustrating that these basic needs became a luxury in my country. But if they think, Russians, that they are going to make us surrender, they are deeply mistaken." That's a quote. So you are helping a country that stands in this war, that keeps on fighting and is going to prevail. And not only it's fighting this war, but it's going through extensive program of reforms. So we're using these reforms, your resources as well, to make sure that we are expediting the changes in our system. We are strengthening our institutions to make sure that we are ready to join the European Union as soon as possible. So I will end with this. This help is going to people that need it, but also this help looks into the future of a happy Ukraine, I hope, in the nearest future. So, tack så mycket, Sverige. Thank you.
Camilla.
Representing the Swedish people, representative of the Swedish government, but maybe foremost from one mother to another. Thank you very much, Your Excellency, Ambassador Zalishchuk. What you're doing is most impressive, and we are very proud to be a part of that struggle and that transformation. Väldigt naturligt.
It is, of course, incredibly valuable to hear the thoughts of Madam Ambassador in order to increase our understanding for how this support program and similar partnerships can contribute to the social welfare to people who are in the most vulnerable positions. The partnership with Ukraine within healthcare and social policy area will strengthen both Ukraine and Sweden. Sweden have very long-term plans for both aid and military support to Ukraine, and we are pushing for contributing more to Ukraine in the next EU budget, long-term budget. Sweden will continue to support Ukraine for as long as it takes. Thank you very much, and we open up for questions. TT?
Ambassador, will this kind of support package really make a difference for the Ukrainian people right now? I guess you have a lot of more urgent needs related to medical care.
So, sorry, your question is whether it will impact the situation?
It will make any difference for the Ukrainian people right now, or is it just in the long run?
No, it's actually happening every day. As I've said, and I elaborate on that. So I visited Karolinska, Svante Norberg is working on that, and Regeringskansliet, one of the organizations helping it. And you are delivering this ICM equipment literally right now. Ukrainian doctors are studying here for a few weeks, and then they go back and they able to use these systems actually to help Ukrainian children that in a most vulnerable position. This Ukrainian hospital that I'm talking about, Ohmadit, was bombed by Russia and almost destroyed a year ago. And Swedish government also gathered some money to support it. And Ukrainian doctors get these particular trainings that, in a way, unique knowledge, unique skills to use these machines to help, for example, these children. So I'm telling you that dozens or hundreds of children have been already treated with these machines that Sweden has delivered to Ukraine right now. Also, this cooperation is happening not only with Ohmadit, but with other children's hospitals in Ukraine. Same as Minister Tenje has mentioned. Our Minister of Social Affairs was here in Sweden just in autumn, and he visited different institutions here in Sweden and learned. We as Ukraine learned and tried to get your experience of how your institutions are working in order to replicate it in our system, in our institutions, how to improve the care, the services to different vulnerable people. So it happens as we speak. It's not something that will affect us in 5 years. It's happening every day.
Thank you.
Thank you.
TV4.
TV4?
I work for TV4 News. I think it was mentioned by Minister Forssmed that during this year, 2026, 36 attacks from Russian attacks have happened against hospitals. Is that an increase? Are they more attacking hospitals now than before, like an increase in energy infrastructure and logistical hubs like train stations, etc.? So is it a certain Russian, how should I say, modus to right now attack constantly hospitals?
Thank you very much for this question. So I would probably say that there are two factors. First, that Russia managed to intensify the production of their rockets and their drones that they are able to use to attack our social infrastructure. Sorry. So why? Because in the beginning of the war, the production, for example, of Shaheeds was much more modest. But they managed to cooperate with Iran, North Korea, China, and get all the spare parts. Unfortunately, some spare parts, lots of them also coming from the democratic West, because Russians managed to find the loopholes to detour the sanctions. So today we face the situation when they can overnight send not dozens of drones like it was in the beginning of the war, but hundreds of them, thousands of them sometimes, hundreds of rockets. So that's one factor, that unfortunately their production has intensified and they became more successful with the capacity to hit. But second, of course, what you mentioned is that now they feel that they want to put even more pressure on Ukraine during the negotiation process, and Putin feels that he is unpunished for this attack on the civilian infrastructure. And it's not just a tactic, or it's not just an accident. This rockets hits civilian infrastructure like railway stations, hospitals, schools, maternity hospitals. It's a terror, and Putin tries to pressure the civilians so that the people put more pressure on Ukrainian government to say, okay, enough is enough, we can't bear it anymore. So this is their strategy, using the basically war crimes, crimes against humanity, to push Ukraine into the corner for a surrender. And you are absolutely right, these attacks has intensified. They're more, less precise attacks, so they are once again attacking all kind of civilian infrastructure, and we have even more casualties today.
Okay. One question then.
Please.
Are you trying to move the hospitals underground to safer space, or is
Yes.
that not a possibility?
Thank you very much for this question. Yes, you're absolutely right. Almost all hospitals are obliged to, actually all hospitals are obliged to build the shelters so that they can move. Sorry. Sorry, I was sick last week and I lost my voice, but I couldn't miss this press conference, because it's really important. So hospitals are obliged to build the shelters, as well as kindergartens and schools. And you will be surprised when you come to Ukraine that almost all our civilian infrastructures have these shelters. So, for example, before I came as an ambassador, I visited Zaporizhia. Zaporizhia is only 30 kilometers away from the front line. It's 500,000 people live there. Few dozen thousand children stay in the city. And schools build shelters with support with Swedish government, actually. And when I've heard that there is an underground school in Zaporizhia, my heart shrank as a mother's heart. Imagine you send your child to study in an underground school. But then when I visited it, I found out that it's a very modern, fashionable, really cool school. My school was much worse, I can tell you. And not only children go to study there, but also other people, when there is air raid siren, when there is alarm, people use it as a shelter, so people can come in and hide while the attack is going on. So these underground facilities allowed cities like big cities, Zaporizhia, 500,000 people stay, keep on functioning, allows people go to work, allows people, parents, send their children to school, which allows us to keep this fight, because this fight demands economy, functioning, country functioning. That would be impossible without these facilities. And as I've said, these facilities also have been covered by the programs that today's Swedish government is introducing.
Bara lägga till en sak där. Hon beskriver ju att det här är intensivt.
If I can add something, she's saying that it's intensifying now, but this has been a strategy by Russia since the beginning of the war, attacking hospitals, schools. I spoke to a reporter, and they talked to my counterparty as well in Ukraine, and they say we now see hospitals as consumables in Ukraine. These are things that will be gone, and that's how they work. You have to move them, you have to reorganize. It's a long-term strategy by Russia to attack civil infrastructure. Any further questions? Then we will break for individual interviews.